So our presentation is on the opioid epidemic that our nation is experiencing right now. If you don't know what opioids are, they are drugs used for moderate to severe pain. They're prescribed for things like surgery and chronic pain issues such as cancer, back problems. But the problem with these medications is that they are highly addictive, and that if you're using them over a long period of time, to continue receiving the same effects, you have to keep using more and more of them. That's called increasing that tolerance level. And they have physical withdrawal symptoms associated with them as well. Some interesting statistics that I saw on an NBC news report says that 46 people are dying every day from overdoses, and that the CDC has put out a nationwide health alert stating that the nation is experiencing this epidemic of painkiller abuse. Um, Healthy People 2020, however, has set a goal to reduce the non-medical use of these prescription pain killers. The most recent average from 2014 was 3.9% of the nation using them in this way. So we're going to try to decrease that. There are a lot of things that are contributing to this epidemic. Some of the things are that these drugs are highly addictive, and that prolonged use can lead to physical dependence. And so this is a problem, especially when you have chronic pain issues, trying to treat the pain without having an addiction to these painkillers. Another thing is the easy access to these drugs. You can get them through prescriptions, through drug traffickers, even from your friends and family. There's also poor access to addiction recovery programs. So people that are addicted can't necessarily get the treatment that they need. So there's a lot of things that contribute to this. Those are just a few. But it's important to think about these things, especially as nurses, so that we can have an idea of the big picture and try to treat this community issue. Some of the preventative measures that are being taken or that are taking place right now are things like educating about signs and symptoms to look for, not only teaching patients' families, but also teaching healthcare providers, such as doctors and nurses and pharmacists, about signs to look for when you might think somebody might have an addiction problem. But you also need to educate patients about when you actually need to use the painkiller and when you don't, so that way that they can avoid this physical dependence. Some of the secondary prevention measures are things like support groups and screenings for overdose and testing for opioid-related diseases. Some of the tertiary prevention are treatment for the symptoms of overdose and withdrawal, and also managing the physical dependence issues like nausea and constipation, and just kind of dealing with those other issues related to opioid addiction. You might have some depression and some lack of confidence, things like that that need to be worked through. Some of the things that a community health nurse can do to assess the community and whether or not there is a problem with opioid addiction is keeping an eye on the statistics reported related to opioid overdose. Also keeping an eye on the mortality and morbidity rates related to opioids. Also, you need to assess the accessibility. You need to know whether or not the doctors in the community prescribe these very easily. Is there a drug trafficking problem? Do patients and families know how to properly get rid of these opioids when they're done using them? It's also important to assess opioid handlers' ability to recognize the early signs of opioid abuse, like we were talking about earlier. There are a lot of policies in place that are trying to help this problem, and things are also being worked on. Some of them include requiring education for healthcare providers, the general public, community education efforts, teaching about safe storage, use, and especially disposal of these prescription medications when you're done, creating naloxone distribution programs, and educating pain medication prescribers on the identification and treatment of pain, alternative treatments, substance abuse screening, and mental illness assessments and things like that. All in all, it's just really important that nurses put an emphasis on this problem that we're having, this opioid epidemic, that they can like be aware of the issues surrounding it, that they can know the signs and symptoms themselves, and that they can be willing and able to teach patients and those that they work with, so that um, this issue can be resolved. Um, anyway, just thank you so much for watching this presentation. I hope you enjoyed it. Here are our references. Um, Let me know if you have any questions.